Right. Well, thank you all for joining us this afternoon. I hope you have been enjoying all of the sessions at our first annual conference. Welcome to our session on ED Alerts. My name is Young Huff, and I'm one of the outreach coordinators at Big Sky Care Connect. I'll be your host for this session, and we appreciate your attendance to learn more about our ED Alerts. Before we get started, I want to thank our sponsors. And if you have any questions throughout the session, please use the chat function. Haley will be monitoring the chat for us. All right. So I would like to start out with a message from Rich Rasmussen, who is our Montana Hospital Association's president and CEO.
I want to thank all of you for joining us here on this annual meeting for Big Sky Care Connect. I'm going to spend just a couple moments talking to you about Collective Medical Technologies' ED optimization tool. Now, MHA was fortunate to have the opportunity to work with the federal government's Assistant Secretary for Public Response, or ASPR. Early on during the pandemic, MHA worked with ASPR on a project to send out a series of mini grants to our members. ASPR came back to the state hospital associations and MHA and said, we have an opportunity, or providing an opportunity for you to do something additional, second mile for your members. And it needs to align with a certain set of federal guidance to bring hospitals together to allow for a project that would accelerate adoption or use of a vaccine and also allow for a greater collaboration between providers. And so as the association began to look at what those opportunities were that were out there in the marketplace, one of them that came to mind was clearly the ED optimization tool that Collective Medical Technologies has. Now, many of you might have heard the term EDI, Emergency Department Information Exchange, used in the past, and that is the tool, but a new name. And so the optimization tool is designed to connect emergency departments all across the state of Montana. And if you look at our peer states around us, all of them are using the ED optimization tool. Now, what does that mean for us? It means it creates an opportunity for our hospitals to collaborate between emergency departments to allow those clinicians who are working in the EDs to be able to immediately examine a patient, but also look at where that patient may have been treated subsequently and what care plans are currently logged for that patient. Is that patient in need of any specific medications that might not be present upon admission or upon entering the emergency department? So essentially, anything that would happen within the scope of care delivered in an ED, our clinicians in Montana would have access to that. And it would allow them to be able to see where that patient has been. So, for example, if someone presents symptomatically for COVID-19, we would be able to immediately look and see where that patient may have been anywhere else in the last couple of weeks. That allows us to immediately be able to help with any contact tracing that takes place, but would also allow our hospitals to be able to learn more about the origins of where that person may have been. And then certainly if there's any other health conditions that may have been recorded at any point in the past for which they came to the emergency department. So there are ways in which we can utilize this tool, not only in COVID-19 and our response today, but also in other use cases that can help us to improve care delivery in our state. Let's give you an example, doctor shopping. We know that Montana is a state that struggles with opioid addictions. So the ability to be able to track a patient when they come into an emergency department and to immediately see whether or not that same patient was seeking a prescription, say in Oregon or Washington or Idaho, all surrounding states that use the ED optimization tool. If we're also trying to identify those frequent flyers that come through our EDs so that we can do a better job of managing that patient's care and reduce cost, that is also a use case that can be used. Perhaps if we're trying to address issues related to human trafficking, the tool also has the ability for us to be able to potentially use it to address those issues as well. So there are a number of utilizations for the ED optimization. And so we believe that our hospitals will have the opportunity to use this not only in responding to COVID-19 today, to share what's going on in our emergency departments, to accelerate the use and deployment of vaccines and to share information with our state labs, but also other use cases that can help us to improve healthcare in Montana. So we're delighted to be part of this effort to improve access to cutting-edge technologies that will allow us to align with our peer states and will also empower us with tools that can improve healthcare, that can improve our outcomes, and improve the quality of care that's delivered in Montana. So that's what we're doing right now with the ED optimization tool, and we hope each of you will take the opportunity to learn more and to sign up. MHA has worked with ASPR to pay the first 2 years of subscription fees related to it. So there's no cost for hospitals to use the ED optimization tool. And so with that, we hope that you will use this as an opportunity to onboard your emergency department and use it as a tool so that you can collaborate with your facilities all across the state of Montana. This is something that is being used, as I mentioned, in a number of other states. And certainly as we see in the Mountain West with the growth of COVID-19 and the large number of patients that migrate to Montana during these holiday seasons, having this beginning in this fall and certainly throughout the ski season in the spring and then into our summer season here, it will allow us to be able to also track patient activities in their home states when they come to Montana. So we believe it's a very effective tool and we encourage each of you to use it. And we appreciate the opportunity to spend this moment with you today talking about our involvement in helping to bring the ED optimization tool from Collective Medical Technologies to our providers in Montana.
All right, we really appreciate that message from Rich. The COVID-19 pandemic has definitely heightened the need for improved health and IT infrastructure across the country. As Rich mentioned in his message, MHA has decided to focus on this effort through the ASPR grant by supporting our hospitals and public health in updating their health IT infrastructure. Because Montana is large and sparsely populated with high volume of out-of-state visitors, as he mentioned, we really need a technology solution to improve care delivery and public health surveillance for COVID-19 pandemic and beyond. So Montana Hospital Association and BSCC Care Connect have both chosen Collective Medical's ED optimization as the platform of choice to provide Montana with real-time event notification alerting and care collaboration solutions for emergency preparedness. This platform, formerly known as HIE, will be incorporated into the statewide HIE as BSCC's ED alerts. We would like to implement this at every hospital in the state as soon as possible so we can prepare Montana healthcare stakeholders to mitigate the effects of the ongoing COVID-19 pandemic as well as future infectious disease outbreaks. So Big Sky Care Connect was established in 2018 as a nonprofit organization to establish and operate Montana's statewide HIE and was endorsed by Governor Bullock. BSCC has the infrastructure and partnership with Collective Medical already in place to support this statewide preparedness effort. So we have already established the necessary participation and data sharing framework in the state of Montana and can assist in amplifying the data exchange and contributing information to better inform decisions at the point of care. There's a lot of evidence on the benefits of statewide HIEs and more data is being shared to quantify some of the value propositions. Hospitals that have been participating in their state or regional HIEs have realized better outcomes with reductions in readmission rates, decrease in duplicative services, increase in revenue from better documentation, cost savings from avoiding adverse events, just name a few. Our ultimate goal is to help healthcare organizations achieve the quadruple aim in improving outcomes, improving clinician experience, as well as patient experience, and lowering costs. As you may have heard from previous sessions, Big Sky Care Connect is working hard on standing up the statewide HIE right now. We have built the foundation with integration tools and privacy and security measures, and we're currently working on bringing in the data from participating healthcare organizations to build a robust, comprehensive patient record. Along with the comprehensive patient record, we'll also be providing medication history with data from Dr. First, as well as direct secure messaging and patient event notification as part of our core services. HIEs have really demonstrated their value during the COVID-19 pandemic by providing a platform where vital patient information and hospital status can be shared in real time efficiently and cost effectively. Big Sky Care Connect quickly responded to help address the pandemic in Montana by partnering with Collective Medical to provide a value-added service of ED alerts, which is the focus of the session today. BSCC is also working with Montana State to help providers gain easier access to public health data, including COVID-19 test results. Once we get connected, COVID-19 results would be available in our provider portal, as well as through our ED alerts notification system. BSCC chose to partner with Collective Medical because of their proven track record. Their ED optimization has shown to reduce high utilizer encounters by 81%, 30-day readmissions by 78%, retention rate of 63% for those enrolled in medication-assisted treatment programs, and 50% reduction in violent incidents, which are very impressive. So our alerts will feature a bidirectional EHR integration with Collective Medical that receives real-time ADT and continuity of care information from care entities across the state. They have an extensive network that I'm sure Rachel will share with us more. Additionally, the HIE automatically pushes alerts and curated care information directly into existing hospitals' workflow, allowing the care team members to immediately have insights to properly care for their patients. So at this time, I would like to introduce Rachel Lieber. She's the Client Success Executive at Collective Medical, and she will share with us information about Collective Medical's ED optimization and demonstrate for us how the system will work. Rachel,
thank you so much. Let's see. So I want to go ahead and
sharing.
Yeah, there we go. All right. Good afternoon, everybody. Pleasure to be with you. Ion, can you just give me a thumbs up? We've got the screen share okay? Awesome. Hi, everybody. First of all, you know, when your colleagues and your friends demo better than you do and talk about the value proposition, it warms your heart. What Rich said and Ion said is really why we're doing this. I am going to emphasize a few messages that they gave. One thing that stuck out to me from Rich's message is really focusing on ensuring care coordination across a very large geographic area, which we know is so important right now around the pandemic, but also with patients that are moving with what I like to call the upper left. And then second, on one of the slides that you showed that had the examples of facilities that we worked in, I don't know if everybody saw, but there were facilities mentioned there that are critical access, large and urban, California, Montana, Oregon, Alaska. So there were some characteristics in the material that you heard and you shared that really kind of emphasize how Collective fits into this Big Sky Care Connect family, and then also how we are going to help connect around the Montana emergency rooms. So a little bit about Collective Medical. We have been providing the ED alert modules all across the US for a long time. It was mentioned in Rich's statement how we are connected to all of the hospitals in Washington and Oregon in particular. We also work with St. Luke's and St. Alphonsus and a variety of other folks in Idaho, and then down into Utah, and about 150 hospitals in California, and then most of the hospitals in Alaska. So you're really joining a really incredible network within Montana, as well as across the entire emergency community in the West. Everybody likes a workflow. How is this all going to come together? And just to frame kind of timing, I'm hoping to spend maybe 15 minutes on slideware and a demo, heavily on the demo, and I really want to make this discussion based. But it's important to kind of take a pause. How is this all going to connect? So the outreach team and the interface team at the HIE are working very hard with many organizations that are already connecting, and then any new ones that join through signing the participation agreement to send interface data from your facility to the HIE. And then Collective Medical works with InterSystems, the shared community record vendor, to make sure that we're leveraging those new interfaces, reducing the IT work from your hospitals and EMR teams. And I always appreciate it when we can do one thing once and use it to solve multiple problems like we're doing here in Montana. So as your patients are presenting in the emergency room setting, your ED providers are seeing new patients. The patient walks into the door, They are introduced to an intake staff person. That intake staff person takes a small amount of information from the patient and creates an encounter inside of your EMR. You're going to hear me say inside of your EMR a few times because I really want to emphasize here that the ED alert module starts and ends in your EMR. And that's an important tenet of how Collective provisions these notifications to our partner organizations. So as that small amount of information, first name, last name, date of birth, address, social security number if they give it, is entered into the EMR saying this patient has arrived. Now the patient could be arriving for chest pain, doesn't matter, whatever their chief complaint is. As soon as that notification is entered into the system, Collective Medical and Big Sky Care Connect are told, hey, this patient just arrived. Is there anything else we want to be aware of as we start to do intake assessment and care plan in an emergency room setting? And then in a short amount of time, we're going to send that ED alert back to your EMR, or maybe back to the fax machine at the ER nurses station saying, hey, here are some other things to just keep in mind as you start to get to know this individual patient. So that's the high level workflow. We're going to go a level deeper. Collective platform, I told you, it is a network, it is a platform, and it is a community of people. And I really like stopping there for a second because I like working for Collective Medical because of the people in the care settings that I get to work with that challenge us on how should we be doing a better job of supporting care coordination in a way that actually fixes some of the challenges all of you face in a disconnected, disparate community of people that are trying to share information in a more effective way. And we spend a lot of time really thinking about how to do that. And especially in the emergency room setting, we've really come to be one of the best platforms for delivering the information to an emergency room physician in a way that is easy to digest, it's actionable, and it's designed for them to absorb while, just a few seconds before they're going to go into the ED and actually introduce themselves to the patient. So like I said, again, kind of working on workflow. Patient's going to arrive in the emergency room setting. Your ER staff enter a small amount of information into the EMR, creating an encounter. That encounter creates a notification to the Big Sky Care Connect and Collective Medical platform saying, hey, is there something we need to know about this individual? And then Collective renders back that notification in just a couple of seconds, giving the ED physician enough time to look over that snapshot, is what I like to call it, familiarize themselves with a couple of pieces of information, and then go ahead and introduce themselves to the patient, keeping a couple of things in mind they may have identified on the snapshot. But I want to call out a couple things here, and this is important. We often hear, well, I'm going to get alert fatigue. I'm going to get so many alerts that I'm going to turn, my ears and my eyes are going to start to turn off, and we are conscientious of that. When we start to deliver an ED module alert, we really think about, we're going to give you a notification for a good reason. And we're going to give you some out of the box that we know are pressure tested from our work all across the US, but we also can titrate and customize those notifications depending on the size of the ER that you work in, or the patients that you tend to see, and make sure that we're right sizing that to give you the information you need and it's operationally manageable. So setting your notifications so you get alerts to ED physicians for good reasons. We don't want to over alert an ED physician, they quickly will turn off their patients. Organized in a way that's actionable. This is important. I want to actually give the ED physician and the ER nurse a one-pager, for better or worse, of information written in such a way that if this triggers a little bit of curiosity, I can go to the HIE, I can go to the Collective platform, I can find out more, I can dig into my EMR, but I'm just going to set off a couple of things you might want to keep in mind and then go find more information to fill in more history. And then quick. So consumable says 60 to 90 seconds, usually takes me about 30 seconds to read through one and go through the high level sections and see if there's some things I need to be aware of. What you see there is actually how it will appear to the ER physician inside of the EMR integration, or if it faxes and prints on a paper notification in the ER. The look and feel is very similar. I'm not going to spend a lot of time here. I did a really good job going over how do we all connect from a technology perspective. But the one thing I would call out is we are actually accredited through the American College of Emergency Physicians. This was identified early on that collective platform really helps to break that cycle of overuse of the emergency room for unnecessary visits. And we've seen some really compelling outcomes in Oregon and Washington, Alaska, around increasing the security and safety of your ER staff and also decreasing utilization of the emergency room for unnecessary visit types. So we work very closely with ACEP. What I like to just pause here on is that we know there are a lot of you who are trying to organize who's doing what. And the ER in particular likes to play a catching role for individual patients and do their best they possibly can to understand what this right now, but also set them up for success to transition back to community. And so as we know that the emergency room is a part of the care team, we need to give them information in such a way that empowers and communicates what you know about an individual from the primary care setting, the behavioral health setting, other hospitals that have interacted, but make sure that we're communicating in a way that they can hear it and is effectively integrated into their natural workflows. So that's what we focus on at Collective Medical when we're thinking about the ER. So with that, I'm going to jump ahead here a little bit. So going back to that theme of, I'm going to notify you for a good reason. Like I said, we always give a few out of the box notifications, and we heard from Rich talk about the ASPR grant. It was very relevant that that grant came in tied to ensuring that we're communicating information around the COVID-19 pandemic and patients experiencing signs and symptoms of coronavirus. So I'll talk a little bit more about that. But that sits at the bottom and with a couple of other really key notifications that we often provision to every hospital as they're going live. The first is what you'll hear called the high utilizer notification. This is generally, it's a line in the sand that has worked across our network. Most emergency rooms want to know any patient that comes into their emergency room who has had 5 or more emergency rooms before showing up today. That's an indication of we might have a cycle trending in the wrong direction and something else is going on here and we need to intervene and probably refer them to case management within the emergency room. So we can start at 5, we can go up or down from there, and we've seen very high thresholds set. I need to know about all patients who've been in the emergency room 20 times in the last 12 months. If you are standing up a high utilizer program within your emergency room, and you've staffed a social worker and caseworker who's really focusing on a very high risk population. Complementary to the 5 and 12 or the high utilizer, we talk about the traveling patients, we talk about rising risk individuals. These are patients that for a variety of reasons have gone to 3 different emergency rooms in a short amount of time, either 60 days or 90 days. That can indicate a few things. Now, these are just examples. It could be lack of secure housing. It could have had bad experience. The individual may have had unfortunate experiences at other emergency rooms, and they're kind of looking for a place where they can get care. They may have recently moved to the community and they're trying to establish care. And we want to understand, why is this traveling behavior happening? And is there something we can do in the outpatient setting to give them a better, deeper connection with a mental health provider, a primary care social worker? And the list goes on. So we look at that traveling population or rising risk. Patients with care guidelines. So in our platform, we enable caseworkers and care managers from the outpatient side to provide a couple of succinct, specific action-oriented suggestions. Call this patient's sister at this phone number upon arrival. These care guidelines are very important because often in an ER setting, the ER physician and the ER nurse do not have enough time to know all of the contextual longitudinal care goals and preferences of an individual patient, especially if it's the first time they've met them. So some of these care guidelines can really fill in some of those informational gaps and help them understand who is this individual they're getting to know. History of security and safety. This one's very important to me. It's very important to our ER staff and our hospital staff that they feel safe at work. And one of our key programs within Collective is our safety and security program. We're one of the only platforms that really intentionally facilitates communication of a patient who has been aggressive towards staff or had another safety or security event. and making sure that that is communicated first to the emergency room staff so they understand if they need to initiate different protocols before starting to assess that chief complaint and understand why this patient is here today. And I'll talk a little bit more about how that shows up in the alert. And then the last two there in gray are pretty incredible. So through the data that we have and the interface connections that we have with all the hospitals, we can also understand patients' conditions. So patients with history of sepsis, very relevant to a patient arriving in an emergency room setting, that the ED provider understands that patient has a history of sepsis, as well as a positive case of COVID-19. Through our work with public health agencies across the US, as well as hospitals, we're able to surface a notification specifically related to if a patient has a confirmed positive COVID-19 lab result indicated by your public health agency partners. And we work with Seattle King County, Washington Department of Health, other counties and jurisdictions, and we're starting conversations in Montana to do this as well. So again, these are just some of the out of the box. We can titrate, we can change these depending on your operational and clinical programmatic goals for ED case management. So how does it look and feel? I'm going to start here and then I'm actually going to go into a full demo. So this is a snapshot of one EMR. You can see that busy screen there, but you see that column on the screen that says EDI. And this is where, again, it comes back to we're going to start and end this workflow in your EMR. So we're going to create that column with your EMR team that's going to place that alert notification, that visual indicator inside of the track board. This is where the ED physician will understand who's the next patient I need to go meet and what do I need to review before going in, as well as the notification, that snapshot report will render directly in the EMR. And I'm going to show you that now. So I'm going to refresh here. Been demoing a lot today. All right, so this is essentially our mock-up of an EMR. We work with Epic, Cerner, Sorian, T-Systems, Meditech. We have probably worked with your EMR vendor in a variety of settings around the US, but we kind of want to have an example that kind of meets the middle of the road. So day in the life, if Jack Nolan is arrived at my emergency room, Ruby Valley Medical Center, steps into my emergency room, is introduced to the intake staff, they're going to immediately create an encounter in my EMR and enter in some basic information about that individual patient. First and last, age, gender, chief complaint, date of birth, address, phone number, and likely social security number or last four. All of those demographic pieces of information, as well as maybe insurance information, create a notification to the network that Big Sky Care Connect and Collective are connected to, saying, hey, do you know anything about this patient that I might also need to be aware of? Within just a few seconds, the alert notification, because we put that column of alerts inside of your EMR, is going to go ahead and go off. And the ED physician is going to see that indicator, and they're going to be able to immediately click on it and read that snapshot notification. Now, like I said, right at the top, you see security and safety events there. And like I said, it's really important that staff are able to establish an understanding if a patient has had a history of violent or aggressive behavior so they can activate security protocols. We also work with security staff if they want to have a pager notification go off if patients have just arrived and we have documented history of security or safety events. So that's first. Then we start to think about the patient's other needs. So again, you see right there towards the top, what we call insights or care guidelines. These are short, succinct, specific suggestions that either other hospitals or clinics around our network are placing in front of the emergency room physician to say, hey, here are some things to keep in mind as you're introduced to this patient that I probably have known for quite a while and am working with on a couple of things. And like I said, that care coordination one is one of my favorite. Call this patient's sister at this number when they arrive. May not be the most obvious piece of information about the patient's goals and the patient's wishes at the point of arrival. So we want to put that really high on the list. Moving down, I can also see some other pertinent care history about this individual. May not be immediately obvious based on that chief complaint of chest pain, and it will help the provider approach the patient. And then we get down into more of the ER history. So right there in the middle of the report, the ED physician sees the last 6 months of ED inpatient and skilled nursing stays, admits and discharges from all across the collective network. So if this patient just arrived at my facility in Billings, but they actually have been seen recently in Oregon or Washington or Alaska or Virginia, those emergency room, inpatient, or skilled nursing encounters are also going to be here, complemented by the chief complaint, the admitting diagnosis, and the discharge diagnosis. Very, very helpful to understand where has this patient been and is there a pattern I'm noticing. We also flip that into more of a quantitative summary view to say, hey, and this, what I like about the ER counts by facility is sometimes you can notice a theme there too. There is an emergency room in this patient's care history that seems to be a place that they have frequented. ED physicians or the ED case managers in particular reaching out by phone, contacting that other emergency room and saying, hey, it sounds like you have some history with this individual. Were you trying to establish some care goals or a care plan that I can also start to work on as I get to know this individual? Moving on down, what you see there next is state-based PDMP or prescription drug monitoring history. In some of the states that we work with, we are also able to integrate a patient's history of prescriptions as reported to the state for controlled substances and controlled medications with the prescriber's name. This is not something we're going to have immediately as we go live, but we continue to work with key policy folks in Montana to potentially add this to the ED alerts in Montana. This is something that we have in other areas around the Pacific Northwest. And then finally, the names and phone numbers of individuals outside of the ER that have a relationship or a care team attribution with this individual. So that could be a clinic-based caseworker, it could be a health plan staff person who's working with an individual through the plan. It could be a general practice office that has that primary care relationship. So that is the ED alert. That is the ED notification. The look and feel of this is very similar, regardless if you're going to get the alert in your EMR or your fax printer. And our implementation team will work with you to figure out what's the right way to receive the notifications. But that is how it looks and feels. So with that, I'm going to just jump back here to everybody's favorite topic of the implementation process. And while I do that, I am perfectly fine. I am kind of calling it in terms of the forum and taking questions and really opening it up a little bit. But yes, we do have about a 12-week process that we work in partnership with the outreach and interface team to establish that interface from your hospital to Big Sky Care Connect. Collective then works with the InterSystems team to take that data over to the collective side, and then we'll work with your EMR and your interface team to deploy that notification all the way back to your EMR. And Bailey Johnson, application specialist, is participating in these events today. She's already working with some of you. She worked with community and she's working with a couple of hospitals already. And we're excited to get to know more of you, work with your EMR teams and your interface teams to get the ED modules connected up for all of you. So Ayang, I am happy to take a pause there. And I think what I'll do, I'll stop sharing for now, but if there's questions that would be helpful for me to bring the demo back up or show my screen, I'm happy to do that.
All right, thank you so much, Rachel. Do we have any questions at this time? Doesn't look like it. I might just go ahead and finish up with the next steps here. How's that? So if you are interested in connecting to Big Sky Care Connect to take advantage of the funding available to cover 2 years of the ED alerts, here are kind of the next steps. You will have an outreach coordinator assigned to you to take you through these steps. So rest assured that you will have assistance throughout all of the processes listed here. So once you sign the participation agreement in the BAA and the collective medical sublicense agreement, the outreach coordinator will work with you to complete the intake assessment form. It's just a 3-4 page form that provides us with some general information about your facility, the key contacts, your training preference, your connectivity goals. And then once that's completed, the outreach coordinator will introduce you to the technical onboarding analyst. The analysts will coordinate a discovery call with you, as well as your EHR vendor and our InterSystems rep to scope out the project. We will establish a connection and then start on the ADT interface. And once we get that started, then we can initiate the collective medical interface implementation that Rachel was speaking about. And then we can go live with the ED alerts as soon as that implementation is done. That's all I had, and we were going to turn it over to questions. Do we have any questions from the audience at this time? Nothing at this time? Rachel, you must have done a very thorough job.
I know,
always do.
towards the end
I
of the
love this.
day, it's great. We are here to answer questions. Amy, Young and the outreach team have been fabulous to partner with. So let us know, and we're excited to get started.
Absolutely. Well, if you don't have any questions, we can wrap up here and let you get to I think the panel discussion may still be going on at this time, right? So we could end here and let you guys go on to the panel discussion.